Hi, everyone, and welcome back to The Checkup, CMH's brand new podcast. I'm Becky Rupel. I'm really excited today to have with me Katie Parker and Jenna Kintner. They're nurse practitioners in our OBGYN office in our rural health clinic. So welcome.
Thanks for having us. Yeah, happy to be here.
So we were kind of talking before we started recording, and we were talking about on our Instagram feeds and our social media how much we're seeing so much about perimenopause and how it's really become kind of the in thing to talk about right now. So tell me a little bit about, for those of us who don't know, tell me a little bit about what it is, and how common is it? Just tell me all about it.
Sure. So perimenopause is kind of a phase that women will often go through as we start to see a decline in our hormone production. For many women, that can start to happen around the age of 35 or so, where we have some decreased estrogen production. And with that, of course, you're going to have symptoms like maybe some hot flashes, night sweats, insomnia, maybe a little bit more difficulty with weight loss, or you're find that gaining weight happens a little bit easier. What other things can you think about?
I think you hit the main ones. Some people will notice some like mood changes.
Yeah,
hair loss, I think, is another common one.
Mm-hmm. So it's anything that kind of goes perimenopause, like is kind of around menopause. Menopause is defined as like whenever, if you're still having menstrual periods, when you haven't had a period for at least 12 months.
Okay, so I always thought that menopause was the symptoms you were describing. So I think what I thought was menopause is actually perimenopause.
Right, correct.
And did I hear you right? You said that could start as young as 35?
It varies for everybody. Yeah, it varies for everybody.
Really?
So you'll have some people who go through early menopause where they'll maybe even in their earlier 30s. That's not necessarily common, but in general, they'll talk about on average, you start to see hormone changes after the age of 35.
Wow. Gosh, I'm way past that. So tell me a little bit. So for me personally, I really haven't noticed a whole lot of symptoms, but because there's things you can do, like maybe in my mom's generation or, years ago, there wasn't options. It was just something they kind of told you to deal with. So what can you do to manage those symptoms? Because I can imagine some of that's not a lot of fun.
Things you can do on your own. There are some supplements out there. The downside with supplements is they're not FDA regulated. So as far as like safety, we can't really give recommendations as far as that goes. Some people swear by them. Some people try them and say they don't help at all.
Mm-hmm.
But dietary changes, exercise, but there are medications that we can use to help control some of those symptoms, because the biggest thing with perimenopause is that phase, it can last anywhere from a couple months to 10 years. I mean, there's no
time frame set.
Yeah, there's no
or anything. Yeah.
golden number.
Yeah.
Right.
And so I say that's probably the hardest thing, is because you just don't know.
Yeah. Basically, biggest things, with your diet is, of course, we want to do as clean eating as possible. So if you can cut out a lot of your processed foods, because they're finding more and more, your processed foods and how you store your foods and everything like that can really affect like hormones. Like they really talk a lot about trying to get away from plastics. You really don't want to be heating your food up in plastic. That can affect estrogen levels and different things too. And as we get past the age of 35, of course, maintaining muscle mass is really important for metabolism, bone health, and different things like that can help you transition into that phase as we go through perimenopause and menopause type stuff. So yeah, and like Jenna said, it lasts different for everyone. But yeah, just talk to your provider, because that plan is going to be different for everyone based off of their health history, risk factors, and things like that.
I hadn't heard that about the plastics before, so that's really interesting. Mm-hmm. And that's an relatively easy change you can make without, upending your whole lifestyle. Talk to me a little bit about, so I'm old enough now that I remember when HRT came out, and I remember it being such, it was great for a while, and then it was, oh my God, they pulled it off the market maybe or something. Yeah, I just remember it being a lot of controversy with it. So talk to me a little bit more about that, because I'm going to guess that maybe things have changed since what I'm remembering.
Yeah.
So as far as hormone replacement, we don't really use any in the perimenopausal stage, other than low dosing, such as like a birth control pill or something of the sorts, because we can't use like just the straight estrogen or progesterone until those ovaries stop functioning, which puts you in that postmenopausal stage. There's always risk with any medications. The biggest risk with with hormone replacement and probably what you're talking about is the like blood clots, heart attacks, strokes, things like that.
Yeah. So I think like when you're talking about, they've kind of changed some of those regulations. They're coming out with new studies and everything that say maybe some of those risks aren't as severe as they used to say too. And then they're also just finding benefit from, as women get into that decline, they're actually finding, especially if you're a woman who maybe had to have a hysterectomy early on and you don't have your ovaries anymore, you really do need some of that like estrogen replacement for, it has a lot to do with your cardiovascular health, your bone health, your brain, like your memory and cognitive function and everything. So hormones can impact all of that. And they're finding too, there's different forms of hormones and they can be absorbed differently and have less risk factors as well.
If that's something you'd have to be on for the rest of your life, I mean, you take it to get you through that menopause.
Right.
And then is it like you wean yourself off, or how does that work?
Right. So usually,
We like to have you off the hormone by like 70. Because it's all about risk versus benefits. And so like the benefits that you're getting at that point are not essentially worth the potential risks.
but yeah, when it came to that point, you talk to your provider, look at weaning off. There are types of hormones you can be on for like the rest of your life, but those are usually more topical or pinpointed hormones, like for some women. And I think this is coming out more and more. And whenever you had Cassie on with urology, she may have talked about it a little bit as well. But when we talk about like vaginal estrogen, so that's a big one that I try and really talk to all my perimenopausal women about. So what vaginal estrogen is, it comes in different forms, whether it be a ring, a pill, a cream. But what we're doing is we are targeting that vaginal tissue with estrogen. So what estrogen does for vaginal tissue is it improves lubrication and elasticity to that tissue. So commonly, as you go through peri or postmenopause, you may start to notice an increased vaginal dryness, pain with intercourse, maybe some increased occurrence of like infections or UTIs and stuff. And a lot of the cause of that is because you don't have that estrogen anymore to keep that tissue stretchy and moist. So bacteria can kind of hide in there or things can just be uncomfortable. So we can add that back through creams, pills, that kind of stuff. It's not something you have to use daily. And then that's something you can be on for the rest of your life because it's...
And those don't have the vaginal estrogen doesn't come with the risk like we do with the oral because it's not
absorbed systemically. Yeah.
Oh, I didn't know that. That's pretty neat. So does everybody need to be doing this? Like, just to use myself as an example, because I'm almost 47. I haven't really noticed a ton of symptoms yet. So do I, like, at what point do I need to come to my doctor and say, hey, like,
if you're not having symptoms, like usually as part of our just like routine assessment when you come in for your wellness, that's one thing we'll talk about. Are you having pain with intercourse? Are you having like increased vaginal itching or dryness or anything? If you're starting to notice that kind of stuff, then definitely when we talk about that topical one we were talking about, that would be something. Now, if you're talking about perimenopause and the hormone changes, then that's going to be, like I said, specific for everyone. If you're starting to notice those symptoms, just talk to your provider or one of us and we can kind of pinpoint what's going to be best for you.
do you find that a lot of women are uncomfortable talking about this, not just this topic, but really by the nature of what you do, anything? Do you find your patients are a lot, like, how do you put them at ease? How do you make them feel more comfortable when it comes to talking to you?
I feel like a lot of those hard topics to bring up, we both kind of make part of our questionnaire, like when we're questioning them,
Take the pressure off of them
so that they don't feel as uncomfortable because we're asking, so they have to,
Right.
They're supposed to answer us. And so I think that that's one of the ways that we kind of take that pressure off of them and open the door essentially.
If they want to tell us, they can tell us. If they don't, they don't. But I think the biggest part of making your patients comfortable in these uncomfortable exams is just creating a relationship with them. So, we'll go in, sit down, have a conversation like you and I are talking right now, get to know our patients a little bit. And then I think just realizing that you're talking to another female provider can give them a little bit of ease and realize that this appointment isn't as scary as they thought it might be.
They kind of feel like you understand. You've been there down that road before. At what age should you make your first visit? Like 18, 19, 21. Before that, what should or does it depend?
It really depends. Yeah, it really depends. I mean, we're seeing younger girls starting periods, 9, 10 years old. And we're seeing a lot more issues with like heavy periods, things like that. If those are concerns, bring them in. We'd be happy to talk about, doing like a low dose birth control, things like that to try to take care of those periods. Cause it's terrible as, you know, a teenager or young adult, let alone, you know, younger, that don't necessarily understand why this is happening. And, you know, their friends at school don't know why this is happening, or, you know, explainable. So, you know, anytime really, as far as that goes, if you're having period issues, as far as like coming in and seeing us on a yearly basis, we like to start seeing patients when they become sexually active, because we like to do STD screenings every year. Pap smears, we don't start until 21.
Yeah, they've changed the guidelines on that.
Yeah.
They found that the reason they changed that is just because when you're young, you have a great immune system, things like that. So say that you're exposed to things like HPV that we know can cause cervical cancer, or cellular changes that could end up being cervical cancer later on. When you're young, your immune system can kind of fight that off. And of course, now we have, you know, vaccines and things against HPV, which they found can help with the prevention of, I think, over 90% of the causes of cervical cancer, because they're hitting those high-risk strands, which we test for anytime we do like PAPs. We're also testing you for HPV per guidelines to make sure that we're not missing anything there as well.
All right. So we talked, you talked about if you're having maybe abnormal symptoms, especially with your period, but what kind of things are abnormal? Like, how do I know if my period is normal or not? What kind of things should I be looking for? And is it different at different ages?
Right. So I think the biggest thing that you need to start with is, you know, we're in a technology society right now. So get that app and start tracking your periods, because that's going to help you as well. Because a lot of women don't always remember when their last period was, when they're due for their next one. So if you can get an app and start tracking it, that's going to let you see a pattern. So say what's normal. I think a lot of cycles can vary, and some women may see cycles that vary month by month. And sometimes that can depend on which ovary ovulated that month, as far as like how long your cycle's lasting. And it's different for everybody. I'd say the normal is probably anywhere from 26 to probably 32 days or so in there. Your cycle can vary. If you're seeing that being a lot shorter, to where you're having multiple periods a month, or you're completely skipping months. And by skipping a month, I don't mean you had a period the end of January, you didn't have one in February, and you had it the first week of March. I wouldn't necessarily call that skipping. Maybe that was just a little bit like prolonged or something. So that's where that pattern is beneficial when you come see your provider or something too. What else do you have to add to that? I guess if you talk about like bleeding kind of stuff too, I consider it abnormal if you have excessively heavy periods. So that can be a subjective term for people. Like, is your period heavy? And they're 16 and they don't know any different. And they're like, yeah, my period's heavy. So then I kind of like chime it into, okay, well, are you using pads or tampons? What size pad or tampon, and how often are you having to change them? If you're like going through a super to ultra tampon every hour, then that's heavy to me. Or if you're like on a big pad and you're changing it hourly, that's pretty heavy. Or having large clotting. Some clotting is normal, but if you're having excessively large clots repetitively your whole cycle, then that's something you want to talk to somebody about too.
And when you say large, we mean like...
That's true. Again, that's subjective.
You know, like a golf ball.
Yeah.
That's pretty decent size.
Yeah.
Maybe a little
Something
bigger.
bigger than a golf ball. Like probably pretty big.
Dime, quarter. Those are fairly common. And as another thing with heavy flows, as long as you're wearing the appropriate size, like tampon pads, you really should never like gush through and go like through your clothes and things like that. If that happens, that's an abnormal too. That's something we would want to know about.
Yeah. Pain. I think pain's another thing. Is this normal? Is this excessive? Are you supposed to have pain with your period? Not all women have pain with their periods, so wouldn't that be nice? But but for some women, I guess if they've lived with pain their whole life, they think that's normal. And if you're having pain where you are like missing work, missing school, you're curled up in bed, that's not normal. You know, there could be underlying causes or things. And I always tell people, look at your family history too. What was your mom doing? Did she have any diagnoses like endometriosis or polycystic ovarian syndrome, things like that can contribute? Because there is treatment out there and you don't have to live with that.
I think people, they're shy, or they don't want to bring it up, or it's uncomfortable to talk about. Yeah. Should go back to like what we were saying about making them comfortable and building that relationship. For sure. Yeah. So in addition to just like your beginning of your health, you also work with patients through pregnancy, but even before that, conception and fertility.
For sure.
So I think sometimes there is a misconception that if they're having fertility issues, they have to go out of town. But that's something that we can do, right? Talk to them. So tell me a little bit about what options we have and what kind of things that you guys can offer.
The biggest thing that we can recommend, of course, is tracking periods. On all those apps, they have the fertility apps. They've got different things like watching your mucus changes, your discharge changes, your body temperature, other symptoms, things like that. Really what we're looking for with those apps is, are your periods regular? And it gives us an indication of when you could possibly be ovulating. The biggest issue with trying to conceive usually is if people aren't ovulating on a regular basis or in that regular time frame.
Yeah. I mean, now they make it so easy. You can, buy ovulation test strips off any other local pharmacies, online, different places like that.
Yeah.
So you can be tracking that at home too, versus just kind of guessing or wondering if you're tracking symptoms, right?
Yep.
Mm-hmm.
If ovulation's not occurring, then that's things that we can help with. There's medications that we can prescribe that help promote ovulation.
Yeah.
And then on the other side of that, if you are ovulating, then we try to figure out, is there something anatomically not working? Is there a blockage in the tube? Is it the partner? We'll check semen analysis to see if he's not the problem. I want to say the problem, but if that's where
He could be contributing
to the lack of success. Yeah.
Yeah. So basically come see us. We can review your history, even look at the basics, like, are you having intercourse around the time that you're ovulating? Are you, doing different things like that? Is your thyroid off? So we can look at all that kind of stuff. And then we can do some basic testing here, the semen analysis. And and then there are medications to make you ovulate if we determine you're not.
Because I think when people are going through things like that, especially trying to conceive if they want to and can't, we can feel very alone. Is it a common thing? Or tell me a little bit about how you guys handle that.
Yeah. I feel like it's becoming more common, especially just with, I think, increased health problems and issues, and probably a lot of our dietary choices and things can definitely impact our underlying health that can lead to problems. I think from studies I've read, it can be anywhere from 1 in 5 to 1 in 6. So maybe around 20%.
Registry. I mean, that's
So it can vary, and it can vary amongst, how old you are makes a big difference too. So
I feel like we're seeing a lot of
people
with not having children, in their 20s and more late 20s, early 30s.
Yeah. There's another study I think I read where when you hit if you're 30, especially past the age of 35, your ability to conceive reduces by 50% or something like that compared to a 20-year-old. So usually we'll tell you if you're wondering if you have fertility problems or not, if you're under the age of 35, if you have tried to conceive for 12 months and you have not gotten pregnant, that's when you want to maybe an alert should be going off to check with your provider. If you're over the age of 35 to 40, usually say about 6 months of trying. If you hit 40, you may just want to talk to them about what your plans are that you're trying and that kind of stuff too.
So it's pretty common, and people shouldn't feel embarrassed or anything like that.
Yeah.
Yeah.
Because if nothing else, I mean, that's just something we want to help people with, because we know, when people are wanting to conceive, that's a super emotional thing, and that can cause a lot of strain anxiety wise. That can cause strain on your marriage or other relationships. So we want to help you with that. So definitely wish people just be open with us and talk to us about it. Yeah.
So once you find out that you are pregnant, whether you went through fertility treatments or just got lucky, so what, when do I need to call the doctor? Or when you've peed on the stick and you're like, oh boy, here we go. What do I need to do next?
Yeah.
Once you get that positive urine pregnancy test at home, we recommend that you call the office. At that point, we order a blood pregnancy test, and it gives us a number to kind of give us an idea to see if it correlates.
Tests are kind of hard to. Is it positive? Is it not positive?
You think they're so
stuff too
early.
I mean, it used to be you miss your period.
Right.
Yep. And then once we get those blood results, then we schedule a new OB appointment. Based off of those, we like to see patients around 8 weeks pregnant. And some people that don't have regular periods, if you're going off your period, we don't necessarily know that it's in. So that's where those numbers come in and help us kind of give us an idea of when we need to schedule. Now, say we're taking medications that we're not sure that they're safe during pregnancy, things like that, we can always address all that prior to that appointment. We'll bring you in sooner than that 8-week mark to discuss all that.
And you're really there for them. I mean, I remember it was like once a month, and then it gets a little bit closer until every 2 weeks, and once a week. You guys are really there they really hold their hand through the whole process, because it can be kind of scary a little bit.
Right. That's a question.
It's a wonderful time, but it can be a lot sometimes, especially for first-time moms. Because you kind of referred to medicine. Talk to me a little bit about supplements. I mean, everybody and their brother is trying to sell me a supplement when I go online. Should I just ignore all of those? Is there anything I should even think about, or anything I need to talk to my doctor about? Or should I just be like, this is all just snake oil?
So supplements, they definitely have their place, I feel like. So they can be super beneficial. You just always want to make sure, I don't have like any specific necessarily brands or anything, but just make sure you're using like a trusted source. And supplements can affect how other medications are, metabolized, or they can increase risk factors. So you definitely always want to consult with a provider if you're on any other medications prior to starting them, or if you have any underlying health conditions. Basic ones that I always recommend for everybody, of course, if you are a woman who's thinking about pregnancy or in that age range, a daily prenatal vitamin is not going to hurt anything. You don't have to wait till you're pregnant to start it. A lot of your studies that show the benefits of it are based off women taking it for at least 6 months prior to pregnancy. So that's always a good one for all women to take. And then the other big one I always hit up is magnesium. So if there's one I'm going to talk about, it's magnesium, because a lot of us are deficient in it. It has so many great benefits with helping with sleep, anxiety, muscle pain. I've had some women in that perimenopause period even feel like maybe it helps with some of their like hot flashes or different things too. The other thing I always tell people is if you're going to take a vitamin or a supplement, like a mineral, so magnesium or iron or different things like that, make sure that you're always combining it with a vitamin, because you need vitamins when you take minerals for absorption. So when you take magnesium, you always need to take it with some vitamin D. And in your perimenopausal state, or after the age of 35, we know we're at increased risk of bone loss because of our decreased estrogen. So we want to increase our calcium. So women in those age ranges should be taking a calcium supplement. Your daily multivitamin isn't going to cut it, because it's got like, most of them I think have around 200 milligrams of calcium in them, and we're recommending 1,200.
Oh my God.
So yeah, and then you want to take that with vitamin D as well, usually around 800 units. You're probably not going to take too much vitamin D, because we're in the Midwest and we're all deficient. So yeah, so the more the better on that. But you take magnesium at bedtime because it can help with sleep. So if I'm going to recommend one, it's that. And then of course the calcium for those menopausal women.
So is there a certain kind of magnesium? Because I know there's different kinds, different, I guess, supplements or formulations or whatever.
Right.
So what should we be looking for?
That's a great question, because there are different types of magnesium and they all do kind of have their purpose. Usually a generalized magnesium that I'll recommend is just the magnesium glycinate, because it should have less of those GI side effects or gastrointestinal upsets that sometimes you can cause. So you think about magnesium, even like we're using that like Milkamag or things like that to help with constipation too. So yeah, glycinate would usually be a pretty gentle one to start with and take in the evenings before bed.
Okay. If there was one thing that you wished every woman knew about her health or about coming to see the doctor, what is it? What do you want every woman to know?
I think really just the importance of coming to see us. I know it's not anyone's favorite thing to do, especially if it's just for routine pap smears, things like that. We try to make it as, comfortable as possible, quick and painless. But also we don't want to miss any of those things that we could potentially help with if you're having issues. And if you don't come and see us, you tell us, can't make it better.
Yeah. Yeah, definitely. I'm kind of the same on that. I just wish that women knew that we're here for them, and there's a lot of things that can be taken care of in their like generalized well woman visit. So they'll come in, I don't know how many times you come in for a well woman. You think you're coming in just to talk about, your periods or different things like that. And we end up, really talking about how you've been struggling or having lots of mental health, you're super anxious, or you're having a lot of depression, or you're having all those perimenopausal symptoms and you don't know what's going on, or just different things, and we're here to help. So a lot of times we can just end up getting them the help that I think a lot of women don't always feel comfortable bringing up, or don't always put themselves first to talk about. Right. So when you come in, it's not just about your uterus. We kind of take the whole body into perspective, and I just wish women would take the time to care for themselves in that way.
I think that's a great thought to end on, and a great kind of thing to remember as we move through. So anyway, thanks so much for joining us today. Really appreciate it having you. Hopefully we'll have you back. Yeah. So wonderful. Thanks so much. All right.